Well, good morning if you're on the West Coast, and good afternoon if you're on the East Coast. Hello, and welcome to the Health Literacy Solutions Center January webinar. My name is Scarlett Juarez, and I'll be moderating today. Thank you for joining us today. Before we begin, I would like to cover just a few housekeeping items. Connect to audio using your computer speakers. All attendees will be muted during the webinar, but please feel free to type in your questions through the Q&A. After the presentation, or even during the presentation, the speaker will be able to answer your questions. If you're not familiar with the Q&A, it is found at the bottom of your screen. To bring it up, simply hover near the bottom of your screen and you'll see the Q&A symbol. If you click it, it will bring it up and you will see and be able to send questions. If you are having some technical issues, send an email directly to support@healthliteracysolutions.org and our technical support will try to work it out for you. Please note that this webinar will be recorded and will be posted in the Health Literacy Solutions Center website in our archives. So you will have access to the webinar and all of our previous webinars on the Health Literacy Solutions Center site. After the webinar, you'll receive an email with a link to an evaluation form. Please take a moment to provide your feedback. We value it very much. For those of you who would like to receive CEU credits, you must submit a completed evaluation in order to receive your credits. So make sure that you keep an eye out for that email. With that, let's go ahead and get started. It's my pleasure to introduce today's speaker, Michelle Roberts, who is the founder and clinical director of the Relational Trauma Recovery Center with offices in St. Louis, Missouri and Portland, Oregon, where she practices EMDR, attachment-focused therapy, and other evidence-based trauma models. She is a nationally certified counselor licensed in Missouri and Oregon and a member of the EMDR Disaster Network, a group of experienced EMDR therapists offering acute trauma treatment for healthcare professionals, first responders, hospital workers, and therapists who have been working on the front lines of the COVID-19 pandemic. Michelle Roberts is also the author of the Institute for Healthcare Advancement's new publication, How to Manage Your Anxiety During COVID-19, a guide that will provide you with information and ways to manage your anxiety when it comes to dealing with COVID-19. We will be sending more information about this micropub in the post-webinar email, so we'll be on the lookout. Michelle, I will now turn over the presentation over to you.
Thank you so much. And thanks everyone for tuning in and for coming back this week. I appreciate it very much. So today, let me quick go over what we're going to cover. Today, we're going to learn how to explain how the pandemic's impact on mental health can create additional health literacy barriers. We're going to identify how mental health symptoms like depression, anxiety, and trauma can really impact health literacy skills needed to follow public health guidelines, which, as we know, have been ever changing. How to identify how low health literacy levels can impact COVID-19 patients, their families, and their medical providers, and learn what health educators can do to help medical professionals identify and intervene when mental health issues impact health literacy issues. So that was a mouthful, but let's just kind of roll up our sleeves and get into this. So we're watching these numbers, and sometimes, we need to turn away from the numbers a little bit, because when we look at them, what does it cause? For most of us, anxiety. And we've been living in this anxiety now for almost a year. And every day those numbers click up and that anxiety rises. And that feeling that we get in our bodies with anxiety, when you combine that with, isolation and uncertainty, it creates, when that goes on, that can create depression over time. So I like to talk about COVID-19 as not just a virus pandemic, which it is, but it's a co-epidemic of the virus and mental health. So I just want to play a little something for you. This is just the numbers where we were as of last night when I went to bed. I'll just talk about the US deaths. We were at 409,877 when I went to bed last night. We're expected to hit 500,000 by the middle of next month. And here's just the daily update. Okay, so it's really kind of impossible to fully grasp the magnitude of this public health and mental health emergency. Truly, I don't have to say it, but there's never been anything of this magnitude in any of our lifetimes. So fear of COVID-19 has exposed a lack of health literacy in this country that we in this community of health educators and communicators have been talking about for a very long time. The problem, however, has been amplified by half-truths swirling in social media and misinformed statements by folks in the public eye. And in some cases, a deliberate campaign of disinformation that has all but thwarted the incredibly challenging task of containing this deadly virus. So let's talk a little bit just about what we know about, so those are the numbers about the virus itself, but what are we learning about the mental health threat? So the COVID-19 pandemic has created both a short-term and long-term negative consequences for mental health outcomes. So symptoms of anxiety and depressive disorders have more than tripled among US adults compared to this time last year, with women and Black and Latinx communities most acutely impacted. More than half, 51% of respondents surveyed across 7 countries by the International Committee of the Red Cross reported that the pandemic had negatively impacted their mental health. Research in the UK has found that 1 in 5 people infected with COVID-19 will develop mental illness within 90 days. That's anxiety, depression, insomnia being the most common. But they're also seeing significantly higher risks of dementia. So we've got 2 things happening. We've got stress-related illness the depressions, the anxiety from living through the pandemic itself. But then we're also seeing this other group of illnesses coming from the folks that actually had COVID or have lived through COVID. And they're presenting somewhat differently. More than half, 51% of respondents surveyed across the countries report that the pandemic has negatively impacted their mental health. And CDC surveys show that since the pandemic began, 40% of Americans are now grappling with at least one mental health or drug-related problem. When it comes to young adults, ages 18 to 24, that number is a staggering 75%. We're going to talk more about that later, about some groups that are showing up as particularly vulnerable in all of this. So according to, let's see here. So what I'm seeing in my work and what I'm hearing around is that helplines, suicide hotlines are dealing just with an increasing number of first-time callers who are being triggered into mental health problems, as well as those who are relapsing because their fear and anxiety have become intolerable. My specialty is EMDR therapy, which is a form of trauma therapy. And as Scarlett mentioned earlier, I am a member of the I'm sorry. I'm a member of the EMDR Disaster Network, and we provide trauma therapy to frontline workers, nurses, emergency responders who are, on the front lines of working this pandemic, or have lost a loved one to the pandemic themselves. Besides that, most therapists I know have never experienced such great demand for services. We simply really can't keep up with people fast enough. So when we talk about barriers to health literacy in this kind of unprecedented context, we really find ourselves in uncharted waters, from nurses and therapists to health communicators. So what do we know on a good day? On a good day, health literacy is hard. 93 million American adults lack the health literacy skills to understand and use health information. And 1 in 5 American adults have health literacy skills considered to be below basic. Factors that have always impacted patients' ability to understand is patient literacy and communication skills, health knowledge, provider communication skills and behaviors, and the US healthcare system, which on a good day is really confusing and overloaded. It doesn't even come close to, as you know, where we are now. So everyone can have low health literacy. Everyone can have a hard time understanding health information. It's always changing. Patients are often very vulnerable, and everyone can have trouble using and acting on health information. Now, on that already existing backdrop, we are stressing an already incredibly stressed system. So what has health literacy been looking like lately? These are just some anecdotes that have been out there. A Michigan library had to ask patrons to stop microwaving books to kill the coronavirus after noticing that they'd been returned with scorched pages. The Cleveland Clinic issued a public warning about the danger of using vodka concoctions as a hand sanitizer when recipes started to circulate. And the CDC had to remind people not to drink bleach or rinse food in it. And of course, the current mental health epidemic also impacts health literacy because we know that mental health impacts our ability to understand. Just some examples of that. People with anxiety can experience a reduced working memory. Studies show that the part of the brain that handles fear and emotion. The amygdala is more active in people with PTSD, and over time, PTSD changes your brain. So the area that controls your memory becomes smaller. And depression often causes an inability to concentrate. We've been talking a lot about how, or I've been hearing a lot about how COVID has really exposed, vast vulnerabilities, across society. And that's true for health literacy too. We're really seeing that the folks who already struggled with low health literacy and were vulnerable to poor health outcomes because of low health literacy are those who are dying in greater numbers from COVID-19. Those include older adults, racial and ethnic minorities, non-native English speakers, and people with low incomes and education levels. I was just checking for a question. So we know that when folks have limited health literacy, they're more likely to report poorer health and less likely to use services, but even further less likely to understand their diagnosis or the actions they should take to treat their conditions. So, and more likely to be hospitalized. So you can see how the confluence of all of this in COVID has been, just a disaster. So let me move forward. So I want to talk now just about some significant communication challenges within COVID-19. And I'm going to focus on two primarily in this presentation. And the first one is going to be disinformation and acute mental health symptoms, because they really are intertwined. But first of all, let's talk about just the landscape in general. Some of the significant communication challenges with COVID-19 are keeping audiences engaged with changing public health guidance. Of course, a lot of this has been politicized, but we saw early on with, of course, masks. As we learn about, as we've been learning about COVID, it wasn't known in the beginning what was the best thing to do. So public messaging becomes very important, and staying flexible in messaging, and having audiences be flexible to receive that information is important. So keeping audiences engaged and understanding that information and guidance can and often does change. That was something that was very challenging, particularly with COVID-19. Like I said, combating COVID-19 misinformation and disinformation. We're going to go into that quite a bit later in this webinar. Writing about race, racism, and disease risk, very important. Explaining vaccine trial phases, talking to older and younger people about coronavirus and how it might impact them differently, and why they should be concerned and take it seriously. And communicating with more people and more health providers than ever are experiencing acute mental health symptoms. So now we're not just talking about our clients or our patients being stressed and experiencing mental health symptoms. Now it's also our care providers talking about experiencing those symptoms. So our doctors, our nurses, but also our therapists who are, to keep up with demand, seeing more clients than ever who are experiencing more acute problems than ever before. the system on all levels is very stressed. So disinformation, of course, adds another layer of vulnerability in COVID-19 and mental health epidemics. And some of you may disagree with me on this, or it's something we can maybe discuss at the end of this, but I have really, in my lifetime, never seen so much, not just misinformation or misunderstanding, but active disinformation around a public health issue. So, and what healthcare and mental health workers are saying that disinformation is really one of the most, or has been, one of the most dangerous elements of the coronavirus pandemic. So what does that look like? What is that? Well, people with baseless or disproven ideas about the pandemic are finding platforms to spread them. Mistrustful anti-science crowds have emerged to condemn masks and other important CDC guidelines, such as social distancing. Political leaders have spread misinformation to minimize the severity of the disease, discredit preventative measures, and sow distrust of government data. And top scientists have been silenced in a way that would have been unthinkable during previous epidemics. So when we talk about, barriers to empowering people with information, it's not just providing information, it's actively combating disinformation in a system, in a pandemic that is already, in a system that is highly stressed. So let's talk a little bit about the difference. Misinformation might not intend to mislead, but it does so nevertheless. Whereas disinformation is deliberately misleading, such as the propaganda or false reports intended to mislead the public, sometimes, but not always, for political purposes. Both can impact people's ability to make decisions for their health by creating anxiety, fear, depression, or stress, and make it more difficult to cope by exacerbating mental health symptoms. Disinformation can also trigger panic attacks, and it can have a negative impact on memory. So how can it impact memory? A 2012 study looked at a large body of research that has examined the impact of misinformation on memory. It assessed whether misinformation could influence the memory of more than 800 military workers taking part in survival school training, which involves stressful, fake POW camps. It turned out that misinformation affected memory of details from the event, such as the presence of weapons or glasses, as well impacted the accuracy of recognizing the identity of aggressive, as well as recognizing the identity of an aggressive interrogator. So in certain conditions, over half of the participants exposed to misleading photographs incorrectly identified a different person as their interrogator after the interrogation was over. So the study concluded that memories for stressful events are vulnerable to being modified when exposed to misinformation. So we can really pretty easily see how memory could be, in this age of disinformation, could also be distorted. So this is all to say that mis or disinformation is really a really important aspect of health literacy and mental health right now. So just when we need people to advocate for themselves at the highest level, because our healthcare workers are so overworked themselves, and that more stress has been created on an already extremely vulnerable population through mis and disinformation. And this is having a devastating cascade effect on people's mental health. And I would also argue physical health. So I just wanted to, I was kind of looking around for just the beginnings of some good work on how to start to combat disinformation, because I think what's going to have to happen in the future is it's not going to be enough to just provide good information. As health educators, we're also going to have to start teaching people how to combat disinformation. So I just found this little piece and wanted to share it. I don't think it's the perfect example, but I think it's a start. I apologize for the ads. We tried to clear them out in advance, but.
During the coronavirus pandemic, disinformation has exploded on social media. Have you read To Hold Your Breath for 10 seconds as a self-check to see if you have COVID-19? How about drinking diluted bleach as a treatment or even a cure? Problem is, it's not true and potentially dangerous. Big Tech has ramped up its efforts to stop the spread of fake news. Facebook prominently displays COVID-19 information, giving users easy access to trusted sources like the WHO. WhatsApp also launched a similar page for healthcare workers, educators, and local governments, giving tips on how best to communicate using that platform. Twitter's removing tweets that recommend cures or advice counter to those of public health authorities, and YouTube has demonetized some coronavirus content. But ultimately, it may be up to you to be your own disinformation detective. So, here are some tips that you can use to spot coronavirus misinformation in your social media feed. First, ask yourself, is the content more surprising, inflammatory, or politically one-sided than you'd otherwise expect? Is the post urging you to share it? Are there blatant misspellings or poor grammar, and does someone stand to profit from the message? If you answered yes, it might warrant a second look. And that means checking to see if the handle is verified by the platform. For pictures, do a reverse image search to see if any of the photos originated prior to the COVID crisis, or go to the verified handle or page of any authority cited. Remember that breath test? Depending upon the version you read, it may have cited Stanford University. And if you were to check their Twitter page, you'll see it debunked right there, specifically calling out the content as misinformation.
So in addition to the sea of misinformation and disinformation around COVID-19, what are some of the other mental health challenges facing people right now? Well, as a trauma therapist in 2 major US cities, I don't think it's overstating it to say that this truly will be a twin epidemic, the virus and the subsequent mental health epidemic. So COVID-19 is expected to take a lasting and significant toll on the mental health of millions of Americans, truly, for decades to come. So what are some things that my colleagues and I are seeing? We're seeing widespread despair and feelings of vulnerability. We're seeing fear of getting sick. And when I say fear, I mean sometimes paralyzing fear of getting sick. Loneliness that accompanies quarantine. Grief of losing people that we love, and the life that we knew. We're seeing all of the emotional, the emotional reactions to living in a fragile economy, whether that's job loss or being underemployed or working from home and having to homeschool children while you're working from home. So we're seeing all of that, and it's all combining to create really complicated challenges to mental health and mental well-being. The work that I do, as I mentioned, I'm a trauma therapist, and in my world, we measure people's activation or being triggered on a scale of 0 being neutral and 10 being the worst it could be. And our goal as therapists is often, by the end of a session, to bring someone to a 0, at least in that moment for a time. And it's very hard these days to get our folks to anything below a 3 or a 4. The baseline activation of our trauma clients is just so much higher, just because of everything that is happening. So how do these challenges impact mental health? Uncontrolled fear and worry about health and the health of loved ones, financial situations or jobs, or loss of support services. We are seeing changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, worsening of mental health conditions, including anxiety, depression, and as I just talked about a little bit, PTSD or post-traumatic stress disorder, and of course, increased use of substance, tobacco, alcohol, and others. We're also seeing an increase in suicidal thoughts. In general, we're just starting to quantify all of this. But we do know, like I said, that suicidal thoughts are on the rise, up 11% for all ages in a recent survey. But what's most troubling is that they are up 25.5% for people ages 18 to 24, so our young people. It's going to be a while before we know whether those thoughts translate into actual suicides. Our system for monitoring suicides is so broken and slow that experts won't really know until roughly 2 years after the pandemic whether suicides have risen nationally. But coroners and medical examiners are really starting to see troubling signs. In Arizona's Pima County, for example, officials have seen 2 health bulletins alerting doctors and hospitals to spikes in suicides. In Oregon's Columbia County, the number of suicides by summer had already surpassed the year's total. The previous year's total, I'm sorry. In Chicago suburbs, DuPage County has reported a 23% rise compared with last year. In the city itself of Chicago, the number of suicides among African Americans has far surpassed the total for 2019. That was in 2020, even as officials struggle to understand whether the deaths are being driven by the pandemic, racial unrest, or both. So what has shocked medical examiners in Chicago is the age range from a 57-year-old deputy police chief to a 9-year-old. So experts warn that the toxic mix of isolation and economic devastation could generate a wave of suicides. But those dire predictions have resulted in really little action so far. So that's something we're really going to have to pay attention to. COVID-related stress is hard for everybody, and it's especially hard for people who have existing mental health conditions like anxiety, depression, or PTSD, or substance use disorders. Those who actually get the disease, because as I mentioned earlier, the brain function impacts. People who've lost their incomes, those who are socially isolated, people who are homeless, those in some racial and ethnic minority groups, and people who don't have access to information in their primary language. COVID-related stress is also especially hard for those who are at higher risk for severe illness from COVID-19. For example, older people and people of any age with certain underlying medical conditions. Children and teens, as I highlighted earlier, we're starting to see some of those statistics that are suggesting that. People caring for family members or loved ones, and frontline workers such as healthcare providers, first responders, and mental health therapists. And essential workers who work in the food industry are feeling a lot of strain, and they often get overlooked. So, I highlighted children and teens and frontline workers because, for the interest of time, I wanted to go into a couple of these. And so I'm going to highlight these two groups with a little bit more information, mainly because we actually have some additional data on these. Not to say that everyone who's suffering isn't important, but some of the new numbers we have on these two groups are particularly startling. So for kids, I mentioned this earlier, but let's go back into it a little bit. The recent CDC poll asked young adults ages 18 to 24 if they had thoughts about killing themselves in the past 30 days, and 1 in 4 said that they had. Youngest people have been hit hardest by mental health problems in general. So this is 3 in 4 young adults are struggling with at least one mental health problem. This can be anxiety, depressive disorders, trauma, and stress disorders, or substance use. When you look at it that way, 75% of our young people currently have one mental health problem. 25 to 44-year-olds, it's now half since the pandemic started. I mean, we just had never seen numbers like this. 45 to 64-year-olds, it's 30%. So, and with healthcare workers, a March survey of healthcare workers, we're just, and let me give you this caveat, we're just starting to get in some data. This is early data, but a March survey of healthcare workers, physicians, nurses, and medical techs published in Frontiers in Psychology found that the healthcare group averaged a depressive symptom score that would qualify as clinical depression, and was 30% higher than the control group. So what that means is that their depressive symptom score was 30% higher than just the general population, which is very significant. The survey was conducted very early in the pandemic, so when this was just starting, and it also found that these same participants were less likely to engage in proactive coping, meaning that they were doing less to prepare themselves for future stresses or adverse events. So I would really like to see how they are doing now. So mental health is really impacting the people that we are relying on: our doctors, our nurses, our EMTs, our mental health therapists, our public health workers, our hospital staff, clinic and primary staff. I mentioned, as part of being in the EMDR disaster network, we are providing trauma therapy to these folks, just to get them through this time. and they are needing it. So when I'm talking about trauma therapy, it sounds like a lot, but they're experiencing high level trauma almost every day that they're going to work right now. So this is what they're saying. These are some of the issues that our frontline workers are encountering when it comes to their own mental health. A quote from a doctor in New York: "Would I really have to decide who lives and who dies?" And a nurse in New York: "I close my eyes and I see the patient that I took care of last. I see the images of suffering. That's going to scar me for life." That is PTSD. So I'm going to put on a little video of that is just going to it's basically healthcare workers talking in their own words. And I'm hoping we're not going to have to sit through an ad, but it might happen.
Stop paying full price when you shop online. You better download Honey, the money-saving browser button with lots of ways to save.
Okay, how do I do it?
Honey scours the web for coupons. Honey scours the web for coupons and automatically applies them when you check out, finding discounts at over 30,000 stores online. Honey just saved you money! Yay! Woo! Honey is quick to install and easy to use. Just 2 clicks and boom, you got the Honey button on your browser.
Yay!
Get Honey for free at joinhoney.com/deal.
Thank you for being patient and sitting through that ad.
The coronavirus is taking a serious toll on doctors and nurses' mental health as America's death toll approaches 200,000. The largest study of frontline medical workers at the height of the pandemic in New York City found 57% of them had acute stress, 48% saw depressive symptoms, and nearly 75% experienced insomnia. Senior medical correspondent Dr. Tara Narula spoke with doctors and nurses in New York City, also New Mexico and Florida, about the stress they face.
You train expecting that someday there may be a catastrophe, but living it is something I don't think you ever fully are prepared for.
We may walk in the building, take care of our patients, do what we have to do, but on the inside, we're suffering.
We just went from one patient to another without having any time between to process what just happened.
It's made me almost rethink my career choice, rethink what it is to be a nurse.
Describe for me the toll that this has taken on you emotionally and mentally.
I don't honestly know if I've been this tired in my life. We're all tired emotionally, intellectually, spiritually. I meet criteria for mild depression. There are emotional places in my ICU I don't like going past because of cases I remember. I'm a 24-year-old with children who died from a stroke, a 25-year-old man who died with his parents and his wife at his bedside. Still hard.
I have terrible insomnia. I experience nightmares. I close my eyes and I see the patient that I took care of last. I see the images of suffering, and I think that's gonna scar me for life.
Nightmares about my previous assignment, did I do everything that I need to do? I feel like the anxiety is kind of just following me into sleep, and so I'm not getting adequate rest.
I tried to fall asleep, but my mind was completely replaying what I went through throughout the day. Would I really have to decide who lives and who dies?
I think surprisingly, we found that about over 50% of individuals had acute stress disorder, which may develop actually in post-traumatic stress disorder. We also found that nearly half of our participants developed depressive symptoms.
Am I gonna live tomorrow? Will I bring this home to my family? What am I gonna do? Just questions.
Having to kind of absorb what family members would usually absorb, where they're at the end of life. And so now we're absorbing that grief in those moments and maybe multiple times in a shift. So that's difficult.
Do you worry about PTSD?
A lot. For the most part, I may be exhibiting slight symptoms of PTSD. I can feel a difference in my personality because I'm usually a bubbly person, and I think I've lost that.
My fuse is shorter. I'm more irritable. I think I'm just frayed. It's like being a rope, where you just twist and you twist, and eventually you fray.
Why do you think it's so difficult for healthcare workers and medical professionals to talk about issues around mental health, like depression, anxiety, fear?
We're kind of expected to just suck it up, to compartmentalize everything we see. We feel as though we won't be valued in our profession if we speak on what we live with on our daily lives and what's kind of part of us.
The white coat makes a great straitjacket that we don't talk about the things we need to, and that needs to stop.
Right now in COVID, the idea of being the healthcare hero really adds this increased burden on individuals.
When you see these billboards of healthcare heroes and our heroes wear scrubs and so on and so forth, and you look at yourself and you realize, I'm no hero. I'm broken, I'm hurting. It's just another point of self-critique that I am supposed to be this hero now, and I'm not. And it's another point of pain.
We're seen as resilient, that we're unbreakable, and if we don't address what we have going on internally, it's really difficult to adequately care for our patients.
COVID-19 has provided us an ability to talk about our own vulnerabilities and to say, that's okay, because from vulnerability, actually, that's the birthplace for courage. It's a birthplace of joy. And I think it's really, really important to be okay with that.
And our Dr. Tara Narula joins us now. Dr. Narula.
Okay. I got a good question. A question came in is, can you describe, let me read it here. Can you give some examples of proactive coping? So proactive coping is when you are you anticipate potential stressors and act in advance to prevent them or to mute their impact. So, I mean, this can be many different things for different people. But for example, if you are if you're a nurse and you have a shift to work, but you know that you have been called to stay sometimes for 2 shifts instead of 1 shift, and you've been getting hungry on your second shift because you haven't had enough to eat, or you haven't even been able to stop to eat, making sure that you pack another lunch or that you eat extra for breakfast, just being anticipatory about something as simple as basic self-care can be one example. Another thing is therapy. If you know that you're being traumatized, and even though the last thing that you think you can handle on top of everything else is therapy, carving out, just being relentless about carving out time to do therapy, because it's easier to get in there and start addressing some of these things than waiting until you feel so bad. It's easier to get in there and get some coping skills earlier rather than waiting until later, and potentially until you feel so bad that you don't seek help at all. And it can also be as simple as taking a walk, drinking a glass of water when you're thirsty in the middle of all of that. So it can be a combination of high level taking care of the self to pretty basic stuff. And y'all might have some additional ideas, but that's basically what it is. So thank you for that question. So just to kind of, we're running out of time, and I want to have some time for some other questions if there are any, but I want to make the point that what we're going through here is, it's a collective trauma. So we're all going through this together. these are just some numbers. There has been one pretty comprehensive survey of healthcare workers. It's not anything that has been, it's not a qualitative analysis or a quantitative one. It's just an ongoing survey that Mental Health America keeps adding to, but it's providing us some pretty interesting data. We know that 93% of our healthcare workers are experiencing stress. 86% are reporting anxiety, 77% frustration, 76% exhaustion and burnout, and 75% say that they're overwhelmed. 76% are worried that they're exposing their kids. And nurses are less likely to have emotional support. So these are all some interesting statistics. It's also having a somatic toll, a toll on the body. So more than half are reporting headaches, stomach aches, changes in appetite. 63% are having work-related dread. 68% physical exhaustion. These slides are going to be available, so you can check all this out. Just to kind of close up, next steps. I mean, there's lots to think about here, but these are just some things that I think would help. It's just normalizing the significant mental health toll that COVID-19 has on specific groups, healthcare workers, and the population as a whole, and appropriate resources accordingly. Create targeted publications and digital tools that can help consumers take care of their own COVID-19 related mental health needs. Please check out the booklet that we did at IHA as an example. I know that Communicate Health has done some interesting work in this area too that I've really been admiring. Address the convergence of mental health and COVID-19 disinformation. For example, relying on false information can dramatically increase anxiety, as we talked about today. If left unchecked, it can give way to depression. So call disinformation for what it is. This clarity is necessary, even when it might be unpopular, and provide tools in a variety of formats to help consumers weed through information and dispel disinformation to help them make better decisions about their personal and our collective health. I'm getting some questions texted in. Scarlett, do you just want to jump in here and ask the questions, or?
Yes, wonderful, and thank you so much for the presentation. Yeah, let me just jump in here. We are getting some excellent questions. So first, Amy, she asked, how can health educators most effectively help frontline workers, both short-term and long-term? She says she works in employee wellness, and they have health departments, correctional officers, Department of Motor Vehicle staff, and police, among other employees. They've been working extra hours for 10 months and no end in sight. Working parents with children in school virtually compounds these issues, and that they remind them of EAP options and offer virtual workshops for compassion fatigue and burnout, and relaxation exercises.
I love those ideas. When I was coming up with these next steps, it was really hard because, everyone is serving a slightly different population with different needs and, different stressor points. But I mean, I think as much as we normalize the mental health toll, that it is just as serious and potentially deadly as, or dangerous and potentially deadly as the virus itself, normalizing that so that people feel, getting rid of that classic mental health stigma. Here especially, anything that you can do that speaks to your audience specifically. I love that. Getting just back to EAP options, but also doing it in a trauma-informed way, because this is about mental health, but it's also has this layer of trauma around it. So going and talking to someone is always going to help. But a lot of these folks, particularly for those of you who serve folks on the front line, they are going to need a trauma-informed approach and even trauma therapy. So familiarize yourself a little bit with what that is and how you could do some health information around that, how it's different from, classic counseling and therapy, and because there is a difference. So, I mean, I think that could be helpful too.
Great.
Excellent question.
We also have other questions, one from Stephanie Stevenson. Could we have the link for the video that was about debunking if COVID information is true or not?
Yes, it's in, Scarlett, it's in the presentation, but
I could go ahead and
share it. Get it that way, or do you want me to send it separately?
I'll go ahead and include it in the post-webinar email, the links to your videos. So yes, you guys will receive that information, those links.
And you all might find better ones out there. I really searched hard for, I think that one is probably not the best one for a low literacy audience. And I don't think it was created for that, but I just wanted to find a starting point. And I thought that was probably the best one that I could find out there right now. As an example, I think of where we are going to need to start going, and then developing tools like that go one step further for low health literacy audiences.
Okay, another question. Do you think EMDR should be better shared or communicated among the masses? I have never heard about this coping strategy until recently, and I believe that it would be widely beneficial to many considering the state of our world.
Thank you for asking that question. Yes, what I can say about it, I can say about trauma therapy in general is that EMDR has been around for a while, and it's been used really by the government for a very long time as kind of the gold standard for treating PTSD among service people returning from combat situations. So it's always had a very robust robust reputation and science behind it. But in the past 10 years, I would say that it's gotten more and more use just in the general population. And I think it does need much better marketing and understanding about how it works. And especially now that we are headed into a period of time where we have this huge collective trauma, and so many folks are going to be needing evidence-based trauma therapies at that highest level. So I couldn't agree with you more. Sadly, it doesn't have a very friendly, health literacy friendly name. It's eye movement desensitization reprocessing for health literacy understanding, but it is a very powerful trauma therapy and there are some others that are emerging. And the field of trauma therapy in general has just been exploding, really even in the last 5 years. More widespread public education about all of those things that are now available and how they are different from classic therapies is going to be really helpful to a lot of people, I think. And that's not to poo-poo on other forms of therapy, but there are some really fundamental differences that are important. Trauma therapies work for people who are traumatized for a reason. I mean, they work differently and are just far more effective.
Thank you. We are at the top of the hour.
Thanks, everyone.
Thank you. Yes, thank you for a wonderful presentation today. If you don't mind skipping to the last slide so I could let people know.
Oh.
The next one, yes. Okay, like I mentioned before, the recording will be available on the Health Literacy Solution Center. You will receive an email containing a link to the evaluation form. And if you are requesting CEUs, your response to the survey is required in order to receive those. And as you know, we try to schedule webinars once a month. So keep an eye out on the Health Literacy Solutions Center website for details on upcoming webinars. Well, thank you again to our speaker and to everyone who joined today. Stay safe and you all have a good day.